Hi guys, welcome to a lecture on the nervous system. My name's Sam Willis and I'm the Senior Lecturer for the Australian Paramedical College. Now this session is designed to give you a bit of a snapshot into nervous system assessment. It will also provide you with a little bit of as a recap of the different parts and divisions of the nervous system. But of course, this is one of the more technical aspects of paramedic practice. So you really are going to need to do quite a bit of reading around the nervous system, which nerves do which function, because remember what the nervous system is designed to do. You have these nerves or neurons that are constantly collecting information about the outside world, and they're relaying them up to the brain to be processed so that some kind of action or reaction can take place. So that's really what we're going to talk about today. So we're going to take a look at the different parts of the nervous system, the different divisions. We're not going to go into a massive amount of depth because we don't want to overwhelm you with knowledge. We're going to recognize a number of nervous system assessments and the reason behind these. So for example, the 12 cranial nerves that stem from the spinal cord will give you some indications as to how to assess these and what you're looking for. We're going to talk about the components of the face-arm speech test in order to identify a cerebrovascular accident or a stroke. And of course, we'll be talking about the Nexus Criteria when managing the patient with suspected trauma. So as you can see in the short session, we're covering quite a bit of content here. So don't forget you can pause this session at any time. All right. So let's start with the basics then. So the central nervous system is made up of the brain and spinal cord. That's the central nervous system. There's also this thing called the peripheral nervous system, which is divided further into the autonomic and somatic nervous system. These have specialized functions. Now, we're going to focus mainly on the central nervous system. And remember what we said, the nervous system sends information about the internal and external world to the brain for a response. Injury and illness can affect the functioning of the nervous system. And as the paramedic, it really is your job to try and work out what is the primary cause of you being called. And is there any nervous system involvement? In other words, has the injury or illness started to affect the nervous system? And the real only way you can determine this is through a thorough history taking, as well as a focused neurological assessment combined with all of your experiences and knowledge around the nervous system. So this is what we've just said, and I do think that a picture paints 1,000 words. Here you have the central nervous system here, which is the brain and the spinal cord. So that's the central nervous system. And then the peripheral nervous system is the autonomic and the somatic divisions of the peripheral nervous system. So as you can see, there's a lot to think about here. I mean, even the specialist scientists are still working out parts of the brain. They're still trying to find exactly what every part of the brain does. We're finding things out about it all the time. So we've mentioned that the central nervous system includes the brain and the spinal cord. I had to put this in here because you need to know that the spinal cord runs down through the spinal vertebrae. Now these parts here are the back or the posterior portions of the vertebrae. These are spinal processes. Imagine if there was a patient attached to this spine, they would be facing that way. So they would be facing forwards. So this part here is the back. This is the front. Notice how the spinal cord and the vertebrae is S-shaped. And notice how you've got this thing here called the brain stem, which is a really important part of the brain. It really does keep you alive. It controls the respiratory and cardiac nerves. So having a look on here, this really does zoom in and shows you where the vertebrae and the cord sit. So here you've got the cord, and it sits directly in between the anterior and the posterior bones. And then you've got these other pink things here called discs. And the purpose of the disc is to help to take basically some of the shock. They're mini shock absorbers, and they sit in between each vertebral bone. So they're called intervertebral discs. Now this next image here shows you how the nerve relays information up to the spinal cord, and then how the motor nerve pathway takes the signal directly up to the brain and then relays it back down to the arm to move if you're in pain or you're too hot or you're too cold. So it's an ingenious system. Now, the cranial nerves run down through this system and exit at different points. So in a little bit, later, we're going to talk about each of those cranial nerves, and we're going to talk about how you can assess those. So, for example, if you damage certain cranial nerves, you'll be able to see these in your patient's presentation. So the big question is then, when do we actually assess the nervous system? Because we don't want to be telling the patient to blow their cheeks and raise their eyebrows and bite their teeth and put in a light in their eye if it's absolutely unnecessary. As with all the rest of the assessments that you do as paramedics, respiratory assessment, cardiac assessment, you only undertake those if you're suspecting there's a problem with the respiratory or cardiac centers and when you're using differential diagnosis. So when there are clear signs of trauma, you definitely want to be thinking about doing a nervous system assessment, because as you've just seen, the spinal cord runs down the center of the vertebral column. When the patient or bystanders, rather than the patient themselves, or rather than anything you've witnessed, report trauma, sometimes you'll arrive on scene and the bystanders will be saying, yeah, he fell from a height, or yeah, he was hit by a car at high speed. That's when you need to consider doing that nervous system assessment or some version of it. And we'll talk about different versions of the assessments a little bit later on. When the patient presents with any unusual signs or symptoms, and when the past medical history dictates any type of condition involving the nervous system, and this can be anything from previous head injuries through to previous cerebrovascular accidents, all the way through to any of the nervous system diseases, such as motor neuron disease. So the different parts then of a nervous system assessment from a pre-hospital viewpoint include these aspects. Number one, the Glasgow Coma scale, or the Glasgow Coma score, which is determined by the scale itself. So these, as you are aware, are comprised of eyes opening, verbal response, and motor response. Here you can see that the eyes opening, you have a choice of 4 to make. There's either spontaneous, eyes opening, they open to speech, they open to pain, or they don't open at all. And of course, you give the number based upon the response that you've found. Then, of course, there's the best verbal response. When you talk to your patient, are they orientated? Are they confused? Do they make inappropriate words? In other words, are they talking about something that does not fit the situation? Or do they make incomprehensible sounds such as groaning? Or is there no verbal response at all? And then the motor response, ask them to shake your hand. That's great, that's a 6. Localizing, withdrawing, flexing and extending. And again, you get a different number for each of these. So the total score can be 15 in total, or 3 if somebody is completely unconscious. So if there's no eyes opening, no verbal response, and no motor response, then that's a 3. It doesn't go lower than 3, and it doesn't go larger than 15. The face-arm speech test. Here we have an example of the face-arm speech test. Now, strokes can be caused by one of 2 things, either a blockage in the brain, which is an ischemic stroke, or a hemorrhagic stroke, which is a bleed, either of which will have different signs and symptoms and may press on your cranial nerves. So when you're looking at the face, have a look to see if there's any, to make sure it's symmetrical. In other words, if you draw an imaginary line down the middle of your patient's face, is there any drooping at the eyes, nose, or mouth? If there is, that's a positive face-arm speech test, and you would treat it as if they're having a cerebrovascular accident. Ask the patient to close their eyes, get them to place their arms in front of them. When you let go, you can support their arms up. When you let go, that one of them will drift, and that's called arm drift. If there's arm drift, that's positive again. If there's not, it's negative. And speech, do they sound slurred? Now, you generally have about 60 minutes to recognize this from the beginning of the call, in other words, the beginning of the symptoms, to you getting that patient in hospital. That usually, so time is, they say time is brain. So it's really, really important that you get into the habit of assessing quickly and moving to the hyperacute stroke unit as quickly as possible too. This next nervous system assessment is a mini neurons assessment called motor sensory circulation times 4. And this is done, this is something as simple as checking the hands and legs for movement. So get the patient to squeeze both hands, put some pressure against the leg and say move both legs. And if they can move both their arms and legs, that's motor, that's great. Circulate, sensory, get them to close their eyes, tap on one of their legs, tap on one of the other leg, and then the arms and so forth. And if they can feel everything, then that's sensory. And then there's circulation, feel for a pulse in all 4 limbs. And if they have all of those present, then that's MSC times 4. Now, the last one is a little bit more in-depth and thorough. And of course, you're going to need to do quite a bit of reading around this because you can't do this in everybody. So for example, if somebody's having a stroke, a CVA, you wouldn't necessarily ask them to stand up. And that's what some of the assessments for the cranial nerves assessments ask you to do. So let's just start with this one. Here's your focused neurological assessment. On here, you can see in Roman numerals, you've got your different cranial nerves. You've got 1. So basically by asking your patient to do all of these things here, we're not going to go into these today, you're basically assessing the cranial nerves. So as an example, you can get the patient to smell things, you get them to smile, frown, stick the tongue out, do these different tests here. And it's as simple as getting the patient to do all these different things and you can assess the cranial nerve. Now for us as paramedics, the 10th cranial nerve is one of the most important cranial nerves. That's called the vagal nerve. That controls the heart rate. And sometimes you will be going into a patient's address and they are collapsed in the toilet because when you go to the toilet and you strain, it does activate the cranial nerve, which causes a bradycardia, or they also call it a reflex bradycardia. And if your patient's already having already has a heart problem and you strain that nerve, it can cause your patient to collapse and go into cardiac arrest. Typical signs or symptoms of spinal cord injuries very much depends on the location. And this might include cessation of breathing if you injure C3, 4, 5. It might involve tingling and numbness lower down if you injure the lumbar vertebrae, paralysis in one or all limbs, confusion, abnormalities associated with any abnormality associated with the cranial nerves, as you've just seen on the previous slide. So it's a little bit more complex than saying you will get all of these signs and symptoms. And again, it's beyond the scope of this lecture to talk to you about every single one of those things because it's a separate subject in its own right, going into the different signs and symptoms and where you're likely to find signs and symptoms depending on the location of the injury. So do invest a little bit of time working out which cranial nerve controls which and what types of symptoms you're going to get when you're stimulating different parts of the nervous system. And then finally, we're going to talk about the Nexus Criteria because this is really useful for you as paramedics when you're trying to determine if you're going to immobilize the patient or not. Now, let's be realistic. When you immobilize a patient, you are potentially injuring yourself and the patient because you're putting yourself as the paramedic and the crew in very difficult positions, including laying flat to immobilize the C-spine, you're log rolling, you're manually handling patients in a way that shouldn't be done. And of course, you're strapping a patient to a very solid board for prolonged periods of time, which causes tissue necrosis and all sorts of other problems. So what happened was a large study was produced, undertaken, and it was an X-ray. It was called the X in the Nexus study stands for X-ray. They produced this large study that measured responses from thousands of people over a long period of time. And as a result of this study, they found that if your patient presents with any of the 5 listed below, then you really should be immobilizing them if they've had trauma. But outside of this, you don't need to immobilize your patient if they do not have any of these 5, which is great news for paramedics because historically, we never used to have this available to us. We were not allowed to clear the C-spine. And that's what this is doing here. So let's go through these together then. Number 1, altered level of consciousness. So if the GCS drops below 15, that's altered level of consciousness. In other words, they're groggy, they're drowsy, and they've had some trauma. Number 2, they've had trauma and they've had the presence of drugs and or alcohol because they won't be able to identify the pain and therefore the problem with the spinal cord. Focal neurological deficits, so if you ask them to squeeze your hand and they can't do it, or if you ask them to move their leg, they can't move their leg. Focal just means in one spot. Number 4 is midline tenderness. Now, midline is anywhere down the center of the spine. Now, some of the within the study, it does really relate to midline tenderness just of the C-spine. But to be extra cautious, you could add in midline tenderness down the bottom, because you can still make people paralyzed by inappropriately moving them, because the spinal cord runs down to the level of L2 and lower. And of course, a distracting injury. If the patient's screaming in pain because they've fractured their tibia, they're not necessarily going to know that they've got a fractured C-spine, which is resting on their spinal cord. Okay, so I hope you've enjoyed this session, guys. And the point of this session was to identify the main parts of the nervous system, recognize patient assessment, provide you an overview of the face-arm speech test, and to introduce you to the Nexus criteria that you will start to see within ambulance service guidelines. I hope you've enjoyed this session, and I look forward to meeting you again in other sessions. Thanks.